Okay. Hi, welcome. We're going to start, and then if more people come, then we'll just continue. I'm going to just introduce myself first. My name is Esti Waldman. I'm the supervisor of the evaluation department at On Our Way Learning Center. We're an early childhood program located in Rockaway. We service children in the Rockaway and Five Towns community. I've been working in early childhood for about 16 years now, and I'm in my current position for about 5 years. I'm going to offer two disclaimers. One is that my specialty is in early childhood, but I've kept up with a lot of parents, and that's how I've learned about other services. And another thing is that I always tell people I don't know everything, but I do try to find out. So if you have further questions when I'm done, you can definitely ask. And I also left my email address on the paper, so you can feel free to email me, and I will try to help you as best as I can. We're going to be talking tonight about different services that are available to your child through different programs, as well as learning how to advocate for your child, which is an important skill for parents to know. And we're going to start. It's not hooked up to that. Thank you.
You're the best.
Okay.
It's not gonna work.
It's not going to go in?
I'm gonna advance it to you.
Yeah, okay, fine, thanks. Okay, so the first thing I'm going to talk about is community resources. I'm going to be talking about other services available, but I ended up preparing more than I thought I had time for, so we're going to start with the things that I think people know less about, and then we're going to go on to the ones that people probably know more about. So first thing we're going to talk about is community resources.
So how do you show me how to do one?
Just click.
Click?
Yeah. Or you could just probably press on the pad.
Oh, here we go. Okay.
Okay, so ABA services. ABA stands for Applied Behavior Analysis. This is the research-based service, basically, that's available to children that are diagnosed with autism. So these services can be obtained through early intervention as well as the Department of Education, but that's only during the school day. However, in 2007, through different health insurance reforms and things like that, more than 30 states have now enacted laws that require certain health insurance plans to cover the treatment of autism. And at this point, New York State is one of the states. Most insurances do cover. At this point, Medicaid does not yet cover, but it's definitely hopeful that it's going to be coming in, that eventually New York State will be one of the states that will be covering services for children with autism also. Basically what happens is if a child is diagnosed with autism, then they can contact one of several agencies that are out there, and they will provide them with services for free. These are after-school services, over-the-weekend services, and we'll see soon which services they are. So if your child, okay, no. It's okay.
Okay.
So ABA insurance services include behavioral evaluations. So those are evaluations that are done they're really called functional behavior assessments, where they will go into a classroom or speak to a parent to figure out what behaviors a child is presenting with and how to help them improve those behaviors. Social skills groups, which is very important for children with autism to learn how to socialize with their peers. Functional behavior assessments and behavior plan implementation. So they can do these assessments to see, again, why a child is behaving a certain way, and then put a plan into place that can be carried out in the classroom as well as at home. Parent and caregiver training, and one-to-one therapy for your child with trained professionals. These are BCBAs. Those are people who are trained and doing ABA, and then they have people that work under them that would do that as well. Sorry. Okay. The next one is Medicaid waiver for people with developmental disabilities. This has been around for a really long time. For some reason in our community, people don't really know that much about it. I personally don't know much about it, but I know that it's there, and I know that it is extremely important for a child with a diagnosis to get that Medicaid waiver. So the first question that we would have to ask is, Medicaid waiver covers the disability of a person that's basically, a child has to have a diagnosis. Once a child has a diagnosis, a specific diagnosis that's considered a lifelong diagnosis, such as mental retardation, cerebral palsy, epilepsy, neurological impairment, autism, is attributable to any other condition of a person found to be closely related to mental retardation, because, and again, it would be a lower intellectual functioning, that's like lower IQ scores, adaptive behavior, as well as any child who has a severe emotional disturbance that would be diagnosed as such, schizophrenia, bipolar, different things like that, really severe behavior disorders.
Oh, gosh.
Sorry.
I can't. Maybe I should use the clicker. I don't know.
So I don't have, it's not hooked.
Is there a way to go back?
It's fine,
I don't know. I'm sorry.
no problem. You know what, so maybe, no, I would say I would bring it up here, okay.
So let's do that. And then when I get the battery, it's all, I'll move it back for you. Unless you think that you can control it.
One second, let me just. So again, a child with a serious emotional disturbance, it has to be, well, the last slide that we didn't see was basically that it has to be that a child, this disability that the child has started before the age of 22, and it's considered to be a lifelong condition. And the reason they have these waivers is because they want to help support parents and families that keep these children at home for as long as possible. Once a child is not living at home anymore, then they're under government jurisdiction, and it's a whole different story. But for these children, as long as they're living at home, yes, as long as they're living at home, then they should be able to be covered under this Medicaid waiver. So the next question is, does your income affect eligibility for Medicaid waiver? We know as Medicaid is usually like the insurance that people with very low income have. And the beauty of Medicaid waiver is that the only income that it looks at is the child's income. And most children do not have an income, especially a child with a disability. And therefore, parental income and resources are not considered for children living at home and seeking to be enrolled in the waiver. Okay, now what services can be accessed with a Medicaid waiver? So these are just some examples. This is not a all-inclusive list. And on the back of the sheet that I gave you, there's a website there that I found that it's an amazing resource, that it really went into much more detail about what services are available through Medicaid. Just as an example, before I go through this whole list, for a child who has a diagnosis that's over the age of 3 and not toilet trained, they would pay for diapers and wipes. They would help pay for adaptive equipment in the home, things like ramps for the car, for the home, different things around the house, wheelchairs, standers, different things like that that may be needed in the home. They also help pay for camp, counseling, that's for the child as well as for the family, crisis intervention, environmental modifications, that's what I just spoke about, evaluation, intake, and referral. So if you don't have all the appropriate paperwork in place for your child to apply for a Medicaid waiver, they would take care of that. The Medicaid waiver program. Basically, when you apply for a Medicaid waiver through OPWDD or any of the other agencies, they gather all the paperwork, but if there's any further information that's needed, then they would help guide a parent in terms of getting that in place in order to get the Medicaid waiver.
And camp would be any camp, or it has to be a camp that they approve of?
So camp, and it also covers things like after school programs and things like that, but it would have to be, most of these places work with Medicaid waiver, and it's a known thing. Even there's now a lot of private schools in Brooklyn that accept as part of their tuition that a child has to be a Medicaid waiver child. Any after-school program for these children, somebody was telling me, she goes, you could pay millions of dollars, it's not going to help if you don't have a Medicaid waiver. That's the only way that you could get your child into a program like that. Financial assistance, forensic services, health care, housing and individual support services, in-home services.
You got this list from their website?
This was actually from a different website, but not from that particular one. That particular website, the beauty of it is that it goes through every program that's available in New York, like all the Medicaid waiver programs that's available in New York State, and it breaks it down for you exactly what services are offered and how much money they'll give toward that particular service per year, like therapies and different things like that. Recreation, again, that's like the after-school programs. Respite services, which is really, really crucial for any parent of a child with a disability. Residential services. Service coordination, that's just someone to run everything, help you with everything. Transportation. Okay. Okay, so after this, I'm actually going to talk a lot about services that are available through the Board of Education, but before I do all that, I think one of the most important things for parents of children with disabilities that they need to learn is how to be their child's advocate. Because it's very nice to know about all the programs that are available and all the services that are available, but if you can't access them, then it's really useless. I sit in many, I would say hundreds and hundreds of IEP meetings and early intervention meetings, and there are very, very few parents who, I'm not going to say they don't understand the point of being a strong advocate. They do understand what it means to be an advocate, but they just have trouble navigating it. So I'm going to give you some tips and hints and ideas, really at the end of the day, if you are your child's only advocate. I once had a parent after a meeting, she came over to me and she said, she was like kind of upset. She goes, I didn't feel like I had an advocate at the meeting. I'm the evaluation site representative. I'm not allowed to advocate for a parent at a meeting. I could guide them before, but I can't advocate. And the other person is an administrator, definitely not advocating. And really, the parent is not necessarily, the parent sometimes needs someone to be an advocate for them, but really you have to be an advocate for your child. So what you need to know. First of all, you have to know your rights. If your child is currently getting services, every year you're required to get your due process rights. When you start to have your child evaluated or get into the program, you get a book of the rights. It's lengthy and it's a little hard to understand sometimes. I did offer some websites that are a little bit easier to navigate. Rightslaw.org is a great website, as well as I think it's called childadvocacy.org. I don't remember the exact name of it, but it's on the page over there also. Those like kind of simplify it into layman's terms. But before you come into any meeting or anything for your child, you must know your rights. And you have to present yourself as knowing what you're talking about when you come into those meetings. You have to know your options as well. So before you come into a meeting, know what services may be possibly available and beneficial to your child. You can't just walk into a meeting and say, this is my concern, what can you do for me? If you come in and say in your head, okay, I know I want for my child, just as an example, he needs speech, OT, and PT. He needs intensive, I'm much more concerned about the physical, so if he needs intensive PT, a little less speech, whatever it is, but you have to know what is out there in order to know how to advocate for your child. Speak to evaluators before, speak to your child's teacher and providers before, and know what you're going to be up against when you come into that meeting. By the way, if you have any questions as I'm talking, feel free to interrupt and ask. Advocate, don't fight. This is, I think, very important as well. I see many parents coming in, and it's almost like they have their fists up, ready to fight for services, and it often ends up escalating. Somebody was telling me very proudly how she went into the Department of Education to fight for services for her child who was going into special education, and how she was screaming and yelling. I don't know if she got what she wanted, but at the end of the day, I heard back from people that were in that office about how this mother really just sounded like a crazy person. If you come in, you're composed, you know what you want, and you're firm about it, you don't have to give in, but you have to, as hard as it may be, staying composed and firm is going to get you a lot further than shouting and tears. There's nothing wrong with crying if you're upset about, hearing about your child's disability, but once it gets to the point where you're crying because you didn't get what you wanted, then it usually is not going to get what you want. They call it manipulative tears. I'm just saying there's a word for it in their lingo, and it's thrown back at me a lot. Were those manipulative tears, or was she really upset that her child is so delayed? You have to know your child. Give over as much information as you have available to all who come into contact with your child so that the best decisions can be made for your child. Okay, withholding information in terms of medical issues or things like that is only going to be detrimental to your child. Giving over as much information as you can regarding your concerns, their strengths, as well as their needs is going to help everyone as a team come up with the best solution for your child. Come prepared to a meeting. I cannot tell you how many meetings I go through to, and the administrator says to the parent, did you get copies of the reports? And she says, yes, I did. And she says, well, did you get a chance to read them? No, I already know what they say. Or it makes me very upset when I read the reports because I see how delayed my child is. Or I didn't have time, it was on my kitchen counter, I lost it, I'm not sure where it is. I mean, all the time this happens, and it just doesn't reflect well. You don't present as somebody who's really a strong advocate for your child. If you read through the reports, I always tell parents, bring in the reports, have things highlighted, underlined, questions, different things like that, so that you know that you're really familiar with what was done with all the evaluations. You have to speak to if you need to speak to the evaluators for more information or the providers for more information for a meeting, do that. But you really have to come ready and armed, I should say. And also bring all advocates with you to your meeting. You can bring anyone you want to a meeting with you. Okay? You can bring a doctor with you if you need to, a friend who maybe is familiar with the process, a teacher who's seeing your child, a therapist who's working with your child. They can come to the meeting, they can be available on the phone for the meeting, but this is where you can actually gather your advocates as well. And really there's power in numbers. If you come in with more people, it sometimes looks like, okay, I'm ready to really do what I need to do for my child. Not that if you come alone it's a problem, but it just looks nicer when you have all these people with you. Oh, sorry. And the last one was beware of the phrase, we don't do that. Okay? I have been at many meetings, I shouldn't say me personally, but I've heard of many meetings where a parent asked for either a certain service or a certain number of hours of something, and the answer was, well, district so-and-so does not give, just as an example, more than 10 hours of CIT. Or we don't do dual recommendations where some services are given in the school and some services are given at home. If that phrase is thrown at you, you can always say, I'm sorry, that's not what you do, but since we're doing an individualized educational program, I think we need to look at my child as an individual, really under New York State law, under the IDEA, which is countrywide law. We is never an answer. Every child really needs to be looked at individually, and it's just not a phrase that they should be using. These are some of your rights. Some of them are legal rights, and some of them are just rights that you should know that you have. You have the right to be treated respectfully at any meeting. If any administrator ever talks down to you or is not respectful, you can always say, I'm sorry, I don't feel I'm being treated properly right now, and walk out of the meeting. You can file a complaint, that happens. But if you don't feel that you're being talked to as a person, as an intelligent person, then you can walk out of the meeting. You have the right to have your voice heard. There was a meeting that a parent called me about where the administrator had decided before the meeting that her child was not eligible for services. She still had many concerns, all written out very neatly and beautifully. And she walked into the meeting and the administrator said to her, before she even opened her mouth, yeah, I'm not making your child preschool with disability. I'm classifying as non-handicapped. There's no concerns over here. And she was like really taken aback. And she said, well, I still have all these concerns. So she goes, okay, fine, let's hear it. And she starts reading it, and the administrator said, these are all parenting concerns. This is not a preschooler with a disability. I am absolutely not classifying him as such. Her, actually. Just P.S., the child came back 2 years later to be evaluated again, clearly suffering from a learning disability, needed the services, could have used those services over those 2 years, and the mother was fully within her rights to put in a complaint and say something. This was a mother who ended up crying, but I think I would understand why she would. And if that happens, you have the right to request another administrator or EIOD, that's an early intervention designee, if you feel you're not being treated respectfully. So if you go to a meeting, you don't feel that you're being treated respectfully, you don't feel like you're having your voice heard, you can say, I'm sorry, this is not the way I want to do a meeting, leave, and then put in a complaint to a supervisor, and you have the right to get a new administrator run your meeting. You have the right to a free and appropriate evaluation. So if you ever have your child evaluated and you feel that whatever you were concerned about wasn't addressed or looked at, you have the right to ask for another evaluation, either through a different agency, through a different evaluator, or even through a private evaluator, and the DOE would be required to pay for it if you have enough proof that the evaluation that was done on your child was not appropriate for your child. You have the right to get the appropriate services for your child, and I should add to this, in a timely fashion. I'm actually currently dealing with a parent in New York City. I don't know how many are New York City parents here, but, or actually everywhere, there is a severe lack of therapists, and there have been for the past few months. There was a child who was mandated to get a certain therapy starting mid-February. Parent emailed me today. She still has not been assigned a therapist, and she was asking if she is able to get summer services. We're going to talk about summer services later, but generally children don't get summer services unless they're really severely delayed. And I asked several people that I work with in the DOE if this was possible, and they all told me no. And then I did a little research and I found out, no, if there's a child, if there's a teacher out of school, you give a substitute teacher. If you can't find a therapist for my child, the child is completely entitled to get makeup services. And I'm working with her and just guiding her in terms of getting it. So
What's timely?
there's a timeline. There's always, on the IEP, there's a start date for services. If services don't start by that date, technically you are entitled to get makeup services for your child. Not technically, you are legally. And I really feel that if enough parents speak up about it and complain about it, it will help things just happen in a more timely fashion. You have the right to stop services at any time. If you feel a child's reached their goals or whatever, it's not working for your child, you can stop the services at any time. You have the right to as many IEP meetings as you feel necessary. So if you ever are not happy with services, you want to add services, take away services, adjust placement, never be embarrassed to ask for an IEP meeting, and never be discouraged when they say again, you want another one, because you are entitled. You have the right to mediation or fair hearing if you do not agree with the outcome of a meeting. And there is on the NYSED website, which is again, on the paper that I gave you, as well as in your packet. There's instructions for filing mediation or fair hearing. There's timelines for when they have to respond to you. I'm just going to give you a word of advice. Even if you don't agree with the outcome of a meeting, if they're mandating any services, you should still sign that you agree just so that you get the services to begin. It's not going to affect any outcome of mediation or fair hearing. I looked into that. So this way at least you'll have something rather than nothing. Okay, how does a child qualify for services?
Can you, like,
Yes.
Can you sign partially saying you agree with the services but not with the placement?
So I'm saying there's Nassau County and New York City. It's two different things that you're agreeing to. So I'm not sure what you're talking. In Nassau County, you can sign for services, and there's a place for you to check off that you agree or don't agree with what they recommended. But in New York City, you could just sign and then file for mediation. It doesn't matter. And then when they ask you, why did you sign that you agree, I think it's a valid reason to say, well, I needed him to get something, and therefore I signed. It's not just valid, it's appropriate. Unless the placement is so out of whack that you don't want. Are you talking about at the CSE level or?
CSE level.
Okay, so, and like it's a public school placement?
No, I mean,
Okay, fine.
I'm guessing it.
Okay, we could talk afterwards if you want, okay. Okay, so how does a child qualify for services? So I am not going to go into the whole evaluation process. They actually put it into the resource booklet, even though that's my favorite topic because that's my job. But I'm not going to go into it just because it could end up being long and complex, but this is the basic outline of how a child gets services. So through early intervention, which is ages 0 to 3, and CPSE, which is the Committee on Preschool Special Education, age 3 to 5, there's a few ways that a child will qualify for services. So first is if they have a diagnosed condition with a high probability of delay. Just some examples are cerebral palsy, autism, Down syndrome. Those are just some examples. But if a child has a diagnosed condition, then generally, and it's affecting their development, they will qualify for services. The next is through standardized testing and clinical opinion and therapist observation. A child is presenting with a delay of 33% or 2 standard deviations below the mean in one area or below the second percentile in one area in one of the 5 domains. The 5 domains are cognition, which is learning. For younger children, we'll be talking about attention, play skills, communication, which is both understanding language as well as language output, social emotional, which is how they relate to themselves as well as to their environment, physical, which includes fine motor and gross motor skills. Fine motor is how they're using their hands, gross motor is how they're using their body, and adaptive, which is like self-help skills. I'm just letting you know, I've never really seen a child get services because they had a 33% delay in adaptive, but it sometimes helps at the next level. Also, realize that a 33% delay for feeding sometimes, but that's only if it really affects, right. A 33% delay means that a 3-year-old child is presenting at the level of a 2-year-old, so it's really a pretty significant delay. The next would be if a child has a delay of 25% or 1.5 standard deviations below the mean or below the 7th percentile in 2 or more areas. And if anyone is familiar with evaluations now, they are moving very much away from standardized testing, much more into clinical opinion. So there's a lot more narrative, there's a lot more parental input put in, and the child really has to be proven that they are presenting with a disability, not just a delay. Another qualification is a 12-month delay in one area. It's very difficult to prove. Usually it's for more significantly delayed children. Not really used that much. And another one is atypical development. Atypical development would mean development that we don't want to see at any age. For example, a child who's only using one side of their body, not using the other side of the body, that's something you never want to see. Certain things that fall into the autistic spectrum, like lack of eye contact after a certain age, self-absorbed behavior, those are things that would also warrant a child to get services under these areas. For CSE, that's ages 5 to 21, a child has to fit into one of 13 classifications. So even if they may meet one of the criteria for the 3 to 5 age, if they don't fit into one of the 13 classifications, they will not qualify for services. And these are the 13 classifications: autism, deafness, deafblindness, emotional disturbance. Emotional disturbance does not have to be diagnosed with a specific emotional disturbance. It could just be based on the child's behaviors. We would classify them as emotionally disturbed. A hearing impairment, which is different than deafness. Learning disability, intellectual disability. The difference between the two of them: learning disabilities, a child generally has a pretty average IQ score. When we're talking about intellectual disability, they usually have a lower IQ score, and then there's other deficits as well. Multiple disabilities, orthopedic impairment, other health impairment. ADHD falls under this classification. Speech or language impairment, traumatic brain injury, and a visual impairment, including blindness. I'm just going to say, when a child is going into CSE and they're turning 5, a lot of times parents do care a lot about that classification, not so much because of the label, but because at annual IEP meetings, certain things may be taken away unless they have that classification. I know I spoke to a parent and she said that her child got the label of other health impairment, and she was upset because she really wanted to be speech and language impairment. This way she knew there was like almost a guarantee that her child is going to continue to get speech and language therapy. So this is something that you may want to discuss at your CSE meeting. Okay, so the makeup of the IFSP, which is Individualized Family Service Plan, and the IEP, Individualized Educational Program, just kind of demystifying it. So the first level is present levels of performance and management needs. This is based on evaluations that were done as well as your input. It's going to go through the scores that they got on their standardized testing, as well as their strengths and their needs. Student needs relating to special factors. That would mean like a child who may need assistive technology in the classroom, as well as if they're visually impaired or deaf, different things that they're going to need in the classroom. Goals and outcomes. So when it comes to goals and outcomes, goals are the long-term goals, outcomes are the short steps that you're going to need to get there. Generally, when we get to a meeting, those goals have been put into the IEP ready. You are fully within your right to ask to add goals, to take away goals if you don't feel that they're appropriate. Programs, services, and frequencies. So we're going to talk about the program soon, as well as the services, but those would be like the speech, the OT, PT, if a child is in a program, not in a program. Frequencies, there are laws and guidelines really for how frequently a child gets certain service. And it would be a great idea to familiarize yourself with it as a parent as well. And that's again also on the NYSED website. Just look up how they determine how frequently a child gets any service. 12-month eligibility. So generally a child is only eligible for 12-month services if they have a significant delay, or if they have been proven to have made regression over long weekends and holidays. So usually at an initial IEP meeting, they will not be eligible for 12-month services because no regression has been proven since they've never gotten the service. Again, unless there is a significant delay. Testing accommodation, so this applies more at like, I would say first grade and up level. What accommodations can be made for them, either time and a half for tests or somebody reading a test to them, all different accommodations that can be made.
Having a scribe.
Scribe, right, if they have writing issues. Transition activities, this is for children ages, I believe it's 15 and up, and that's when we're talking about them transitioning out of the school age into the real world. So there would be vocational activities there and strengths and things like that where they're de-heading once they leave. I believe it's in the law, it's 15 and up, but it can start earlier. Participation in state and district-wide assessments. Will they be participating in things like the ELAs, the state math test, the Carolinas? Participation with students without disabilities, which means how much of the day they're going to be spending with their same age peers in a general ed setting. Transportation, if they qualify for transportation, and if they do qualify for transportation, it should be specified in there that they need like a wheelchair accessible bus, air-conditioned van, different things like that.
A matron, right?
A matron, yes.
Well, matron is required.
It's not.
Okay, placement options. So the guiding principle when it comes to placement options is that the Department of Education is always looking to place children in the least restrictive environments. What does this mean? The least restrictive environment is the best environment for any child in which they will be able to maximize their potential while still getting all their needs met. Okay, so there's a continuum of services, and that's how it works. Generally, they try as much as possible to keep children with the same age peers. And then it gets more restrictive with time. Early intervention, there's basically only two. There's home-based services, and there are center-based services for more significantly delayed children. When it comes to preschool, first is general education only, meaning that the child does not qualify for services. After that, it's general education with related services only. Child only have speech, OT, PT, or any other service. Then a special education itinerant teacher services. That's where they're staying in their mainstream classroom, but they have the assistance of a special education teacher helping them either with their cognitive skills or their behavioral skills. See it with related services, self-explanatory. And then after that is a half-day preschool program. It said, or an integrated, or I guess a half-day integrated class. So half-day means that their needs are more significant and it can't necessarily be addressed by a CIT, so they will come to a half-day center-based classroom, get their special education and the related services, and then they can go to a mainstream class the other half a day. And then for children with more significant delays, we would be looking at a full-day preschool program or an integrated class. This I took straight out of the website. I really believe that integrated class is a less restrictive environment than a half-day preschool program. Integrated class is a class that is made up at the preschool level of half children with special needs and half children that are completely mainstream. And I always say the beauty of an integrated class is when you walk in, you can't necessarily differentiate between the children who are special needs and the children who are not. But again, it has to be something that a child can hack before placing them in a program like that. At the CSE level, which is ages 5 and up, least restrictive is considered, well, after general ed, least restrictive is consultant teacher services, consultant teacher services. This is basically where a special ed teacher comes into the classroom to talk to the general ed teacher about how to make adjustments in the classroom for certain children. The consultant teacher does not necessarily work directly with the child, usually does not work directly with the child. Then is related services. Again, those are the speech, OT, PT that we're talking about. After that is resource room program, meaning the child is staying in their mainstream environment for most of the day, but they're pulled out of the class for resource room program. In New York City, at this point, it's not called resource room anymore. It's called SETS, and that stands for Special Education Teacher Support Services. Sorry, it's SETSS. And though the SETS would either push into the classroom or pull a child out of the classroom for whatever they need. Just so you know, if the school can't provide a SET or the district can't find someone to go into the school, you'll get something called a P3, which means that you can find a provider to give these special education services to your child. There's also co-teaching, which is similar to that integrated class that we were talking about in the preschool. It's also called collaborative team teaching class. Just so you know, I don't know of any of the yeshivas in the neighborhood that have integrated class, although I did hear that one might be starting first grade class. At this point, there aren't any. So if you get to that CSE meeting and they start talking about CTT, that may be something you may want to contest because you're not going to be able to get it in
They also call it ICT.
schools.
as well.
ICT.
Yeah.
The next step would be a special class, and there's all different ratios for a class like this. There's 15-1, which is 15 children in a class with one teacher, 12-1, 12 teacher in a class with one teacher, and then again, as the more staff and the less children there are, that's more restrictive, again, depending on a child's needs. And then there's home and hospital instruction. Home instruction is usually when we're looking for placement for a child, they need to be on home instruction, or because of severe behavioral or medical issues, they can't be in a classroom. So then they would get a certain number of hours of instruction at home. Hospital instruction is the same thing. If a child is hospitalized, then they are definitely entitled to services in the hospital.
I think you could do that now.
Yeah. I'm gonna try.
Want to just help me?
Yeah, sure. We're almost done.
Did you press it?
No.
But I'm saying, how do you make that go away?
Oh, just because
That's okay.
And the last one is in-state or out-of-state private schools. So in-state means we'd be talking about any of the private special education schools. Very few over here, a lot in Brooklyn and other places. Or out-of-state is more of like a residential program. In order for a child to qualify for any of the private schools, it has to be proven that the public school setting is not an appropriate placement for them. Generally what parents do is they visit the recommended school, the recommended class, and then they have to prove with the aid of a lawyer that it's not appropriate for the child, and then the state will pay for private schooling for the child. Sorry, I'm just going to check on the phone. Okay. These are some of the therapy disciplines. It is not an all-inclusive list, but this is some that are available. Speech and language therapy, which is probably the most popular. It's provided by speech and language pathologists, and they help with language and communication disabilities. These are some of the things that they do. They help with articulation. That's how a child pronounces language. Language processing disorders. That's how they understand language, process language that's given to them. Expressive language disorders, which is like their output, how they use their language, if they have language. Word retrieval difficulties, similar to expressive language disorders. Some learning issues, especially at the younger age, a lot of language is tied in with learning. And oral motor issues like swallowing, feeding, voice disorders. Just so you know, these are not necessarily covered by the Department of Education, but under early intervention, definitely feeding can be given. At the older age, it's usually there's feeding programs for children that are covered by insurance. Occupational therapy, provided by occupational therapists. Occupational therapists actually do a lot of different things, but for the purposes of education, we're talking about improving ability to perform tasks for independent living, such as self-help and everyday living skills like eating, dressing, functional mobility like moving safely through school, positioning, sitting in class, sensory motor processing. Okay, you're going to correct me if I'm wrong, but sensory processing is basically how a child relates to their environment using their 5 senses that we know about. I know there's 7. I'm going to add that in. Their 5 senses. So their vision, hearing, taste, smell, and touch. And there's 2 extra senses when it comes to sensory motor processing. Vestibular, which is their sense of balance, and proprioceptive, which is how their bodies relate like how their bodies in space.
Lines to the surrounding.
Sorry?
Okay.
Yes, thank you. Sorry, I'm just having word retrieval issues. Speech there. All right. And then there's also fine motor, which is the writing and cutting, and gross motor performance. They would help with that. Usually it relates to muscle tone and improving that as well. Physical therapy is provided by a physical therapist. They help address posture, muscle strength, mobility, organization of movement, and educational environments. I'm just going to say something that physical therapy, if a child has gross motor delays, it has to affect their functioning in the school environment in order for them to qualify for physical therapy services through the Department of Education. Again, it may be provided to prevent progression of impairment or address functional limitation resulting from injury, disease, or delayed development. Nutrition services. This is really only available through early intervention. You could probably get it through insurance also, but it is a great service. It's provided by a certified nutritionist. They help assist parents in coming up with realistic and nutrient-filled menus for children that either have feeding difficulties or they have limitations in their diet, either due to allergies or different diagnoses in which they can't eat everything. Audiology services provided by an audiologist. They support the needs of children with hearing loss and include, but are not limited to, determining range, nature, and degree of a child's hearing loss, individual needs for amplification, and a lot of times they work hand in hand with assistive technology to help improve a child's hearing in the classroom environment. Interpreting services are provided also by speech and language pathologist or interpreter for children who are deaf or hard of hearing with oral transliteration services, cued language transliteration services, and then just other programs. Sorry, I'm not so familiar with this, but just letting you know that it's there and you should know that it's available if you need it. Okay. Vision services provided by a vision teacher. They're provided for students who are blind or have visual impairment related to the pathology of the nerve of the brain waves. A lot of times this means that a child can see their visual pathways are fine, but because of maybe a traumatic brain injury or something like that, they can't see properly. And